Good afternoon, everyone. Thank you so much to Dr. Omar Latif and to the entire Rush medical community for hosting us today. Thank you. We are now on day 2 of the mask requirement being lifted across the state of Illinois. And it comes as we mark a significant milestone in our journey with this virus. More than 8 million people in Illinois are fully vaccinated. Each day we average another 16,000 more COVID-19 vaccinations, including about 4,600 people who are getting vaccinated for the first time each day. Throughout this pandemic, we've taken action to save lives while keeping our economy open. And I'm proud that Illinoisans have done the hard work that has made our state a leader here in the Midwest. Today, our hospitals are returning to more normal patient admissions and are better able to attend to their patients, including those with COVID-19, but also those who have suffered heart attacks, are recovering from car accidents, undergoing cancer treatment, or welcoming a new baby into the world. With the removal of mask requirements in most settings, some Illinoisans may choose to continue wearing masks out and about, even when it's not required. Others won't. And this is a moment when I want to ask everyone to treat each other with kindness and with compassion. What's right for someone else may not be what you would choose, but remember that we should all default to what will keep each other safe and healthy. Someone in your presence may be more vulnerable than you are to the worst effects of COVID. Each of our actions in the presence of a deadly disease can affect the next person. COVID has not been eradicated. Today especially, I find myself reflecting on the journey of the last 2 years. 2 years ago this week, 2 more Illinoisans had tested positive for COVID-19, for a grand total of 4 known cases at that point in the pandemic. 4. At that time, Illinois was the first state that could run our own tests for the virus. In a matter of days, given the speed the virus was making people ill, we would issue a disaster proclamation to activate an all-hands-on-deck approach to this virus. Shortly after, Illinois would become the second state in the nation to issue a stay-at-home order, an unprecedented action to address an unprecedented unknown. Remembering those early days of trepidation, foreboding, and countless unknowns, there is not one of us who could have predicted the full extent of what was to come. A global movement of solidarity and compassion, the sounds of pots and pans clanging the world over, incomparable loss, trauma, frustration, from jobs to dreams to moments, of course, of many thousands of people being affected. Even, unfortunately, a loud minority of voices who have used this emergency to naysay, to bicker, to polarize, and to divide. And through it all, we saw example after example of the unbounded depth of human kindness, from food and gifts for healthcare workers, to hunkering down for our seniors, to wearing a mask to protect strangers, to hosting a food drive or a blood drive or a tutoring group. In this most trying moment of our era, Illinois reminds me every single day of her kindness and her hope. I don't know what's next for us in this pandemic. We have all seen indicators of positive progress, but there is no metric that can predict the future. If there's going to be another concerning variant, or if we convince more of our neighbors to get vaccinated, those are things that are under our control. As for when the pandemic becomes endemic, there's no on-off switch, and such a declaration is not mine to make. I've always promised to listen to the experts, and I'm not going to stop doing that right now. Here's what I do know. Illinoisans are equipped. We live in a moment that has demanded more sacrifice than has been fair. but I have never doubted the ability of the people of this state to see it through. I know that today, with 80% of our seniors and more than half of our eligible residents boosted, and with Illinois leading the Midwest in vaccination rates for young and old alike, it is so good to see so many smiling faces again. The majority of the people of this state did not hesitate to do the right thing for their family, for their friends, for their community, and today we reap the benefits now of that commitment. I know that no matter what comes next, Illinoisans are fundamentally all about looking out for one another. Nowhere is that spirit more evident than in the Illinois medical community. In addition to Dr. Lateef, I am joined today by Julie Pride, the administrator of the Champaign Public Health Department, A.J. Wilhelmi, the president and CEO of the Illinois Health and Hospital Association, and of course our own Illinois Department of Public Health Director, Dr. Ngozi Ezike. From the halls of our hospitals to health clinics to local health departments, these individuals have had no respite from the unrelenting agony of the most brutal parts of this global pandemic. For 2 years, they have battled an invisible enemy with the weight of the world on their shoulders, followed by the burden of saving people who don't believe sometimes that they need to be saved. These people are warriors. There is no other word for it. They give and they give and they give when so many have needed them. Many have done so while missing family birthdays, holidays, and milestones. They have stretched themselves into superhumans, and in doing so, offer the greatest recent examples of humanity and caring. I am deeply, deeply grateful. I always will be. And so are the people of this state. And on that note, I have an announcement and a particularly special thank you to make today. For over 3 years, Dr. Ngozi Ezike has served as head of the Illinois Department of Public Health. With all her being, she has dedicated each day, and I mean every day, to the agency's mission to protect the health and wellness of the people of Illinois. For much of the last 2 years, she's dedicated every night, too. Even with this unprecedented internal workload, Dr. Ezike prioritized joining me at more than 160 COVID press conferences, make that 161, providing not only the latest expertise and data, but also her empathy and her compassion, becoming a beacon of stability for millions during a time of tremendous uncertainty. And she's been doing so both in English and in Spanish. She has an unshakable faith in God, and she has leaned on her faith to give her the strength to care for the world. I have watched Dr. Ezike mourn the loss of every one of the more than 32,000 Illinoisans who have died from COVID-19. This pandemic is a collective trauma that has, for many, numbed their ability to comprehend death on a massive scale. Not Dr. Ezike. No number of sleepless nights and endless days could wear her down her commitment to think first and foremost of Illinois' most vulnerable. I ran for office. She did not. But throughout the crisis, she has stood beside me every step of the way. I am not putting it lightly when I say that she has had one of the hardest jobs in the world. There is something particularly heroic about the service of an extraordinary individual who did not seek greatness, but found it anyway. Dr. Ezike's last day leading our Department of Public Health will be March 14th. It is a change that I'm loath to accept. But perhaps she can finally get a good night's sleep and precious time with her husband and her 4 kids, and boy, it is well deserved. I have utmost faith that Dr. Ezike's next journey will also bring more good to the world. as has been the hallmark of every step of her career. She will go down in the Illinois history books as a woman who changed our state for the better. She saved lives, many, many thousands of lives. And on that note, I have issued a proclamation declaring today, Tuesday, March 1st, to be Dr. Ngozi Ezike Day in the state of Illinois. I ask all of our residents to take a moment today or any day in the future to thank her for her unprecedented public service in the face of a global COVID-19 pandemic. Dr. Ezike has big shoes to fill. She leaves behind these big shoes, and I'm pleased to announce that one of her top deputies, Amal Tokars, who has joined us at COVID-19 updates in the past, will be leading IDPH in the interim as we look for a permanent successor. Amal Tokars has been an instrumental senior member of Dr. Ezike's leadership team, and the people of Illinois will be lucky to have her watching out for them.